patient is a patient who's had herpes zoster keratitis. The herpes zoster keratitis was originally treated some months ago and resolved, and was left with mild subepithelial haze in patchy areas of her cornea, but not severe vision loss. But as often happens, she ends up with a neurotrophic cornea, so you can rub a Q-tip across this woman's eye and she doesn't kick you. At that point, she comes back in with a classic neurotrophic ulcer with rolled edges of the epithelium, tends to be central, inferior, central, and of course that also tends to involve the visual axis with severe decreased vision. At that point, still we'll put in punctal plugs, whether they're temporary or I cauterize them or anything else. Obviously, we're already doing supportive therapy with lubrication, and then the discussion is Procera. And sometimes we can also consider going to the operating room and attaching the amniotic membrane graft, but this lady is somewhat debilitated, older, etc. Operating room's not the best environment. So after, again, just topical anesthesia, get the Procera ring in her eye. She was actually somebody with a large orbit, so I would replace the tegaderm more than once. And in this case, this took about 10 days to 2 weeks to heal. And neurotrophic ulcers, in the past, all we permanently tarsoriphize them and sew the corner of their eyelid together, which is never popular with patients. But even then, that doesn't always work. So this took, I've forgotten the exact timing, but somewhere in a week and a half to 2 weeks to heal. But once it's healed, it has stayed healed.